Approximately 1.9 million new cancer cases are expected to be diagnosed in the United States by the end of 2023. This figure from the American Cancer Society is troubling, but help is available. Today, I'm going to introduce you to a Catholic Health breast surgeon who is saving lives with her skills every single day. Plus, we'll meet one of her patients who has some advice to share after suffering a recent scare. We will also discuss whether genetic counseling can help you learn about your risk for developing cancer and speak to an oncology dietitian about the role of nutrition in a cancer patient's journey. That's all coming up today on Stronger Together with Dr. Dave. Hello and welcome to Catholic Health Stronger Together with Dr. Dave. We have an exciting show planned today with plenty of great information for our viewers. I'd like to start today by introducing you to Catholic Health's Director of Breast Health at St. Catherine of Siena Hospital, Dr. Jana Deitch. Thank you, Dr. Deitch, for joining me today.
Thank you for having me.
All right, so we have a lot to talk about. We're going to be speaking about breast cancer. This is something that probably has affected just about everybody who's watching the show right now. So how common is breast cancer?
So you're right. Everybody knows somebody, if it wasn't themselves, who's been diagnosed with breast cancer. Approximately 1 in 8 women will be diagnosed with breast cancer in their lifetime.
Who's at risk?
So all women are at risk. Men are at risk too, but majority of breast cancers are in women. So the average person is at risk. You don't need to have a family history of breast cancer to get breast cancer.
When do we start screening, and typically how do we screen for breast cancer?
We recommend beginning with breast cancer screening with mammograms starting at age 40. Some women need a supplemental ultrasound with their mammograms if they have dense breast tissue, but baseline screening mammogram starting at 40. If you have a family history of breast cancer or other specific high-risk characteristics, you might need to begin breast cancer screening earlier than 40, but baseline at 40 years old for the average risk patient. You have to tailor it to the patient. So if a patient has a genetic mutation, for example, a BRCA gene mutation, they might need to begin breast cancer screening in their 20s at 25 years old. Some other patients might need to begin screening in their 30s. We would recommend, if they have a family history of breast cancer, starting their screening 10 years before their family member's age at diagnosis.
Gotcha. So people really need to know their family history if possible.
They need to know their family history and all their risks. And new guidelines recommend gynecologists doing risk assessments on patients starting at age 25 to catch those who are at high risk.
Breast cancer is not a medical emergency, it's a psychological emergency. So tell me more about that.
Right. I think you may have taken that out of my mouth because I say that very often to patients in the office. They come in, they're diagnosed, they're very rightfully scared, afraid, angry. They did not think it could happen to them. But they come in and they want treatment yesterday. Right. And I say to them exactly what you said. This is not a medical emergency. You are not dying from breast cancer tomorrow. It's a psychological emergency. So we want to get a game plan. We want to start treatment as soon as possible so that the patient feels like they're doing something, that they're helping themselves through their journey. Breast cancer treatment is very vast. It's constantly changing. Luckily, there are advances in treatment every day. So we are seeing major improvements in long-term survival and rates of recurrence. There's a variety of treatments. There are surgical treatments. Some patients can have a partial mastectomy or a lumpectomy. Some patients need mastectomy. There's chemotherapy treatments. There's hormone therapy treatments. There's radiation. So what you need will be thoroughly discussed at your appointment with your breast specialist like myself. But there's a lot of treatment options out there now.
What are some of the most common questions people ask you when you meet them the first time?
Right. How did this happen to me? And my answer, just like I said to you before, is breast cancer is common and it just happens. So most people have no risk factors and they just get breast cancer. So one of the most important take-home points I think from today and in general is that go for your screening mammograms, because you don't know if you're going to be diagnosed with breast cancer or not. There is no telltale sign who's going to get it or not. So go get your mammograms. Another important question is, am I going to die from this? And most, like we just said, most patients are not going to die from their breast cancer. Breast cancer has a very high success rate, very low rate of mortality from this, but you have to start treatment to get good end results. So ignorance is bliss, right? Ignoring your symptoms is easy, right? But it's not smart. So anything that is concerning, anything that is changing for your breast, go see your doctor right away. Another question, should I go for a second opinion? So what I say to them is, if you need to hear it again, go for a second opinion. Most of us are going to say the same thing. We follow guidelines. The treatment of breast cancer is standardized by guidelines, but you need to go where you feel comfortable. You have to feel that feeling when you go into the doctor and see them. So if you're not comfortable where you went the first time, find somebody else.
Tell me about Catholic Health. I mean, this is a system that has prided itself on compassion. Does that carry over for breast care? Is that something that you guys really hold on to, is compassion?
Yes. So, we say that we're a community hospital with, academic care, academic level care, university level care. We are giving our patients everything that they need in their backyard, in their living room, essentially. We provide personalized care. We know all of our patients. They come in, we know about their family, we know about their dog. They're not a number, they're our patient. And it goes from the whole system wide that everybody feels this way. And this is what we hear over and over again. Patients who choose our care over a neighboring institution chose us because they feel the love and the compassion at our system.
Where can people find you and reach out to you?
My office is located at St. Catherine's of Siena Hospital on campus there. And my office number is 631-862-3171.
Thanks so much for joining us. This was very informative, and we'll definitely have to have you back.
Absolutely, would love to. Thank you.
Coming up next, we'll hear from a patient who was treated by Dr. Deitch and has an important message to share for those people who are putting off their mammograms. That's coming up next on Stronger Together with Dr. Dave.
As farmers and ranchers, stewardship of the land comes naturally. We help keep water clean, improve the soil, and provide habitat for wildlife. But did you know that conservation can also improve your bottom line? Learn more at conservationpays.org.
Welcome back to Catholic Health Stronger Together with Dr. Dave. We just heard from Dr. Jana Deitch about the importance of breast cancer screening and early detection. Now I'd like to introduce you to Nancy Hilsenbeck, a breast cancer survivor who has firsthand experience with this topic. Nancy, thank you for joining us today.
Thank you. My pleasure.
So I'm really excited to speak with you because there's a lot of people watching the show who either themselves or a loved one or a friend is going through, a cancer diagnosis and maybe a breast cancer diagnosis. So tell us about you. Tell us about Nancy in about 3 sentences.
Okay. So full-time I work for a real estate law firm. And then part-time is more my labor of love as a martial arts and fitness instructor. So I teach, kickboxing in the evenings and on the weekends, and I teach kids and adults karate, also in the evenings and weekends.
So you're really active.
Oh yeah. I'm a runner, I'm a hiker, mountain biker, CrossFit, you name it, I do it.
All right, so I'm looking at you, you seem like the picture of health.
Thank you.
So, you're not what most people stereotypically would think of as a breast cancer survivor. Tell me about the diagnosis. How did this all happen?
When I got the phone call, I had just come back from a weekend hiking trip upstate. It was a few days after my birthday. I was up there doing a mountain climb trip. It was sub-zero temperatures, snowing, trudging up these mountains, and I was still waiting for my biopsy results. So when I'm out doing that, I'm thinking to myself, there's no way I have cancer. Sick people don't do this.
Right.
So at that point, I was pretty much convinced that, it was just something else and I'd be fine. I felt fine, so you can imagine when I came home, that following Monday and I got that phone call, I mean, I was just floored.
You don't have a family history of breast cancer?
I do not have a family history of breast cancer.
So no family history of breast cancer,
No.
healthy,
fit,
climbing up in sub-zero
yeah.
degree weather,
and
diagnosed with breast cancer. Okay,
Correct.
Dr. Deitch, here, we're throwing it at you. How common is this?
So it is common. We see breast cancer in all different types of women: healthy women, unhealthy women, young women, elderly women. No family history. It does not discriminate. Of course, a patient who is extremely healthy, like Nancy, will do better. I mean, they have a healthy lifestyle, they eat healthy, they exercise, which we know contributes to good outcomes. So unfortunately, while it doesn't discriminate against the diagnosis, it helps them in the long term.
So when you hear the diagnosis of cancer, what's the first thing that goes through your mind?
Once I got past the initial shock, was just, okay, what do I do and how do I beat this? That was right at the forefront, Gonna call in my troops, my support system, and we're just gonna figure out how to get through this, and come out on the other side.
And how was your experience with Dr. Deitch and her team? Because I can only imagine how scared initially, the shock you mentioned.
Yeah, so, I did what most people do. I dove onto Google and started, just scaring myself left and right. Once I got in with Dr. Deitch, all the fears that I had built up in my mind, up until that point, started to become a little bit less after speaking to her. She's amazing. She spent probably a good hour with me at that initial appointment, going over what the pathology said and reassuring me that it was definitely early. The tumor was very small. It had some favorable characteristics. And just hearing all those words, I was like, okay.
So we talk about comprehensive care at Catholic Health. Your surgery was at St. Catherine's. Mm-hmm. And then what happened with the additional treatment?
So after the surgery, and we found out, more about the pathology of, my tumor and what would be next. Since I live on the South Shore, I was referred to Dr. Deng at Good Sam as my medical oncologist, and she kind of took over from there. And she talked to me about the kind of chemo we would do, what to expect from it, when to start it, and then from that point, I went over to Dr. Cow, the radiation oncologist at Good Sam, and I had a consult with him as well. And both doctors, again, I thought were really incredible. I didn't feel like either one of them saw me as, just another person. Like, they all got to know me personally. And so that was where we went from there. I did the chemo, and then I went to the radiation, and now I'm just on maintenance therapy.
That's fantastic.
Yeah.
So you really, it kind of speaks to, how complicated breast cancer can be.
Oh,
where
yeah,
you have
for
literally
sure.
a team of at least 3 people,
Yep.
3 experts. But the nice thing is they're all talking to each other,
Yeah.
and they're all under the same comprehensive, umbrella or system.
Yeah, absolutely. In fact, when I had some questions for Dr. Cow, I had actually emailed him because I just started panicking over a couple of things. And when he answered me, his answer was, actually, I just sat down with Dr. Deitch just this past week I guess you guys have like a monthly meeting, and we were just talking about you, and I was just like, oh, okay, it just made me feel like, all right, good, they're all with me on this. Everybody's in my corner here.
Yeah. Gives you a lot of confidence in
Yes,
your care.
and to this day I feel that way. Like, this is my team. It's
That's
my
fantastic.
pink army, I call them.
The Pink Army.
Yes,
I like
you
that.
guys are my
Excellent.
pink army.
Excellent. And I think you have to tell the viewers that you have something coming up this fall.
Yes, I'm actually currently training for the New York City Marathon. This will be my first marathon. I am running it for a charity for breast cancer, so I'm raising money for breast cancer research, which is why I dyed my hair pink.
I love it.
To kind of, start conversations about it and get people to donate money. I've already raised over $11,000 for breast cancer
that's
research.
amazing.
So,
Absolutely
and I'm
amazing.
still going. I'm not going to stop.
That's
It's
fantastic.
the most important thing is to find a cure for this thing.
Well, Nancy, thank you for taking time out of your training to join us.
Thank you.
Dr. Deitch, thank you.
Thank you.
This was very informative. Nancy, thank you for sharing your story. I truly believe it will help to save the life of someone watching today. Coming up next, we have another Catholic health expert in the studio to tell us everything we need to know about genetic counseling. You're watching Stronger Together with Dr. Dave.
He helped me learn to read.
It is the best feeling in the world. They impact me. I'm proud of the work that I'm doing.
There's been dramatic results in our kindergarten classroom this year from having a foster grandparent.
Welcome back to Catholic Health Stronger Together with Dr. Dave. Genetic counseling can help to determine how likely it is that you or a family member has a genetic condition such as cancer. But is it right for you? Our next guest is here to answer that for us today. Jessica Kenney is a certified genetic counselor and manager of Catholic Health's Clinical Genetic Counseling Multi-Specialty Program. Welcome, Jessica, and thank you for joining us today.
Thank you so much for having me.
Let's just get right to it. What is genetic counseling?
It's a healthcare profession where individuals go to graduate school to get a hefty education of medical genetics and psychosocial counseling. So the counseling part is the psychosocial part of our job, and the medical genetics is kind of what we're looking for in the genetics. We're specialized, trained individuals that can look at individuals' personal and family histories to kind of indicate, is there a genetic and or hereditary cause for certain diseases. Most commonly, what we do at Good Sam or at Catholic Health is we do cancer genetic counseling, where we're doing counseling and or genetic testing for patients that maybe have had cancer diagnoses themselves, or maybe they have a concerning family history of cancer and they want to know if they have a predisposition, because if they do, we want to be able to prevent by providing them with an arsenal of screenings that maybe they should be going through to be able to prevent cancer in the future.
Who should have genetic counseling? Should everybody have genetic counseling?
So it's a great question, because there are lots of questions out there as to whether we should be doing population health genetic testing, just kind of genetic testing on the entire population. But for right now, there are a set of criteria that individuals potentially need to meet in order for their insurance companies to kind of cover their genetic testing. So individuals who have their own cancer diagnoses at really any age, but when we get a little bit closer or younger than 50, it's a little bit more of a red flag that it might be a hereditary cause. Or if someone has concerning family history of breast, ovarian, prostate, pancreas, colon, uterine cancers. I would say maybe skin cancers not so much, because a lot of that is sun exposure. Lung cancer is not so much, because a lot of that is a respiratory exposure. And then like HPV related cancers, like a cervical cancer, maybe not so much. But those other cancers, if we see a concerning family history where there may be multiple family members with the same type of cancer, we also look at ages of diagnosis. So if someone is, diagnosed close to or younger than 50, in addition to their family history, there are red flags that come up. So it really can be beneficial for almost anyone, because even just learning the information of the differences between how much cancer is hereditary, only about 5 to 10%, versus how much cancer is really sporadic, about 85 to 90%, where you're really just kind of at the mercy of the exposures that you've been exposed to throughout your lifetime. But even just hearing that, because I see the look on your face, even people say, really, it's that low? Hereditary cancer is that low? Yes, the number is that low. But it's beneficial information for almost anyone.
Yeah, it's low, but it's not zero.
Exactly.
And it could be devastating if you have it and you don't know about it. How far into your lineage do you start to say, I should get screened, or my great-great-great-grandmother had cancer, nobody since?
So the further out you get in your family tree, the further up and out in terms of greats and second cousins, unfortunately that doesn't contribute. So we're really looking at most notably first and second degree relatives. We will consider third degree relatives, but then going back to that criteria that I just mentioned, sometimes the insurance companies don't consider the third degree relatives. So we're really keeping it to first and second. When someone comes to genetic counseling, we do draw a family tree, because it becomes a visual tool for us to see, is there certain cancers, the ages of diagnosis, and which family members on what one or the other side of the family can create certain patterns that will give us clues as to whether we think it's hereditary or not.
Once somebody is diagnosed with cancer and we're trying to plan a treatment, genetic counseling, what's the role?
So genetic counseling has a big role, or genetic testing, I would say, has a big role, most notably in like breast cancers. Let's take that for an example. More and more so, breast oncologists, once they see someone who's newly diagnosed with breast cancer, are doing genetic testing on their patients before they go to surgery, because if they are found to have a mutation in a breast cancer gene, then it might impact what type of surgery they have. Are they going for just a lumpectomy, or maybe we should do a mastectomy to reduce their future additional breast cancer risks so that they don't develop a breast cancer in the opposite breast. If a woman doesn't want to have an extensive surgery, then at least we are trying to prevent by telling that person, okay, you have a breast cancer now, but we know that you're at high risk for another one. Let's make sure you're getting breast MRIs going forward. If someone needs chemotherapy, then the oncologist can also look at the genetic test report to see the presence or absence of mutations in certain genes, can give a little bit of an indication as to the most appropriate chemotherapies or immunotherapies that can be used as well. So for genetic testing, whatever information, if we do find hereditary factors, otherwise known as mutations in certain cancer genes, then a lot of the information is prevention for future cancers and or treatment of future cancers.
How do people get in touch with you and your team?
My team runs out of Good Sam. We do see patients out of St. Catherine's and Mercy for cancer services. And our phone number is 631-376-4050. All they need to do is call us. Whether they need a referral is dependent on their insurance, but they don't need, they can self-refer. We don't need a doctor to say you need genetics.
So they can contact you directly.
They can
That's
contact
fantastic.
me directly.
Jessica, this was very enlightening. It's exciting, and we'll definitely have to have you back on the show.
Thank you so much.
Thanks for joining us. What a wonderful resource. Thank you, Jessica. Do you know the recommended diet for a cancer patient? We'll tell you everything you need to know after the break. You're watching Stronger Together with Dr. D.
They said I could play, so any chance to play at all. You know, that's my life. I love music.
Yeah, that's how we do it.
Welcome back to Catholic Health Stronger Together with Dr. Dave. Nutrition plays a critical role in the journey of a cancer patient, and I'm joined now by Ann Levine, a clinical dietitian at Catholic Health's Cancer Institute at St. Francis Hospital and Heart Center, who will share some expert advice in this area. Thanks for joining us, Ann, and welcome to the show.
Thank you for having me.
Why is nutrition important for cancer patients?
So, nutrition is really important for everybody just because when our bodies are properly nourished, they're functioning the best that they can. So this becomes specifically important for cancer patients who have increased needs for certain nutrients and calories and protein in general, especially if they're undergoing some sort of treatment. So being properly nourished becomes really important in that aspect.
Do you have a recommended diet for a patient who is battling cancer or has a history of cancer?
This would really be individualized to the patient. Generally, we like to recommend a general healthful diet, such as the Mediterranean diet. That's our main recommendation for prevention of multiple diseases. And it really, it holds up to research that it's really good for, preventing certain diseases. For cancer patients specifically, we would have to look at symptom management, depending on what their treatment is, and just see really where they are in their stage of cancer. And then we calculate their nutritional needs from there and just kind of go from there, see what they can handle, see what they can't. And it also, takes into account preferences of what they like to eat. So as registered dietitians, we really work hard to make sure that we're individualizing meal plans to specific patients and making it something that they're really going to eat and enjoy.
How do you respond to a patient who says, should I be on the paleo diet or should I be on a keto diet or any other diet?
Generally, we don't recommend any diets that restrict any major food group. It's important to have just a wide variety of lean proteins, whole grains, fruits and vegetables, and that's really what we would say to everyone. They really need to make sure they're getting enough protein in their diets, but as far as, following a specific diet like paleo or keto, we really would just need to make sure that they're getting all the nutrients they need. And as long as they are, then they can continue eating in the way that they choose to eat, if that's how they choose to eat.
And are different foods better for patients with certain type of cancers in treatment?
So again, we really like to advocate for, lean proteins, whole grains, fruits and vegetables, but it would really depend on someone with a GI cancer may not be able to tolerate foods like, maybe spicy or acidic foods, and someone with maybe more localized breast cancer might not have those issues. So we really have to take a look at what the individual is going through and create meal plans around that, and really find foods that will fit into what they're able to handle and tolerate.
What is your biggest concern in cancer patients in terms of nutrition? Is Is it wasting, muscle wasting? Is it a lack of protein, a lack of healthy fats? What is there anything in particular that you really want to make sure that you're covering?
Definitely getting protein, because getting enough protein can make sure that they're not having that muscle wasting, which of course leads to malnutrition. And being properly nourished can really impact treatment outcomes, and any delays that might happen in treatment. It can really make things go a lot smoother if they're getting all the calories and protein that they need.
Do you supplement with protein shakes or?
Yeah, definitely. Usually if people are having trouble eating all their meals, or they're eating, maybe half of what they used to or even less, we definitely would recommend protein shakes and supplements. Sometimes maybe they have their own things at home with powders that they could put into a shake and make for themselves, and adding maybe some other high calorie ingredients like ice cream, and then they could add in any fruits that they want. And we also, we offer a wide variety of nutrition supplements. There's so many on the market, and depending on whatever they're going through, we can really take a look and find the best one for them in, whatever capacity they need.
So, the message seems that there's really no magic diet per se. It's funny, as a cardiologist, I'd probably be telling my patients the same thing. A whole food, mostly plant-based, Mediterranean type of diet, and probably stay away from the quick fix diets, especially if they're going through some type of stress like cancer or heart disease.
Yeah, and if they're, at a point where they're really not able to eat much, and maybe they do have malnutrition, we would probably switch up all the recommendations for them and say, you need ice cream, you need high calorie foods, you need whatever, anything palatable that you'll be able to eat to just get some calories and protein in you. So those recommendations would look a lot different than what you as a cardiologist would tell your patients, and what I would tell, patients at St. Francis.
Yes, I would be a very popular cardiologist if I was recommending ice cream.
Of course.
Absolutely. So this was fantastic, very informative. How can people find you and reach out to you?
Oh, I work at the Cancer Institute at St. Francis. We're proud to have just celebrated 10 years there, and we really take pride in all the care we provide for our patients. So yeah, you can find me there.
That's fantastic. Thank you so much for joining us today.
Thank you for having me.
And we'll have to have you back on the show.
Thanks. Yeah, of course.
All right. That was good information and great advice. Thanks, Ann. Thank you to all of my guests. We hope you've enjoyed this segment of Stronger Together with Dr. Dave. If you would like to know more about Catholic Health, or to make a gift in support of one of the amazing programs you heard about today, please visit chsli.org or call 1-855-CHS-4500. Thank you for watching today. I am Dr. Dave Degatti, and I'll see you next time on Catholic Health, Stronger Together with Dr. Dave.